Back to the non-traditional veterinarian, I want to do a little recap. I recently was at the American Holistic Veterinary Medical Association conference, my first one, and I really want to talk about it. I didn't know this was an organization up until a few months ago, had no idea that they even did conferences. And so maybe you two are someone who would value knowing that information. And why I want to talk about this is it's non-traditional. It wasn't a huge conference, but there was things that happened that I didn't expect to happen when I was there. And so while I was there, the conference started on a Saturday and went through a Tuesday. I attended just the weekend, Saturday, Sunday. I was fortunate enough that it was within driving distance for me. It was in West Palm Beach, and this is how much I didn't even know about like the conferences. I just knew I saw it, I knew I wanted to attend and I could attend and I found a way to make myself attend. I was like, I don't even know if it's even in West Palm every year and learned that it's not. And so I kind of just was like figure it out later kind of situation. And I got there on a Friday. I checked in, was very surprised that the hotel was so beautiful. It was at a Hilton. And I, for the first time, got fortunate enough that the conference was at the same hotel I was staying. And if you go to conferences, you know how huge that is. I've never been able to have that happen. Either I register too late because I find out about a conference too late, or scheduling a last minute allows me to go, or the rooms are booked. And so it was so nice being able to go downstairs and walk my happy little feet over to the conference without having to figure out Ubers or navigating weather with walking. And I like walking when I'm at conferences. I like walking to them. I like walking home, but sometimes the weather doesn't always allow it. In fact, the last big conference I went to was in Austin, Texas, June of 2024, and tried to walk there, and it was just too hot. By the time I got there, I felt like I needed another shower. So I got there Friday, checked in, went to session Saturday and Sunday, and I have to tell you, I had no idea how many people to expect at this conference either. When I tell you I signed up and was like, I will figure it out later, that's exactly what I did. What I did do is I looked at the conference schedule and I was like, okay, am I interested in the topics before I book a hotel, register for the conference? Does this feel aligned with where I'm wanting to take my practice? Does this feel aligned with my beliefs and my curiosity and learning more? So being able to educate pet owners on both sides of the table, whether they're ultra conventional or they're ultra holistic, is there a place for me to learn to serve both? Because what I don't believe in or feel aligned with is, well, if you're ultra conventional, I can't help you. It's like, here's what I do. And I'm happy to help you if with you having X, Y, and Z. This is how I approach it. If that aligns with you, I'm happy to serve you. If not, I totally understand. Rather than, no, you're ultra conventional. I only help pet parents that believe in X, Y, and Z. I don't believe in that. I think everyone deserves to have the information provided to them. And so the energy there was pretty calm. A lot of conferences I go to, it feels like hustle bustle. People are rushing in and out of conference rooms, into the exhibit hall, into lunch. And it wasn't. It was nice that there was gaps in the lecture rooms, that everyone wasn't crammed in. There was some that were more popular than others, but I have to say overall it felt like a pretty relaxing experience. Everyone was very welcoming. In fact, I had a badge, and on the badge, there was this sticker in the back that I put on there that said first time attendee. I was like, I have no problem with people knowing this is my first time. And so it was the energy was very welcoming. It was very, people, you could tell, and I'm not saying that people aren't like this at bigger conferences. What I can say is about this conference, because it's fresh on my mind. I was just there. I'd never been there before. I'd never been around these people. In fact, loved ones were asking me, they're like, who do you know that's going? And I'm like, nobody. I'm literally going solo and I'm okay with it because I'm on mission. I have lectures that I'm so excited to attend. In fact, I had a printout, I highlighted it. It's almost like when you were back in like college and you're picking what classes you wanted. It was that excitement. So many like-minded people. And I think that when you get into these conferences that are very niche, where they're very specific on practice, alignment, or interests, that you get more like-minded people around. And so I found out, I think it was the second day I was there, that there were around 350 attendees, I think, or supposed to be, because I heard that they stuffed around 350 bags. Now, some of those may have been extra for people who signed up last minute. Maybe some people didn't come that were registered, but let's just call it 300 veterinarians. I could be a little bit off with that. So it was pretty intimate for a conference. The community was very welcoming. Several people were like, "Oh my gosh, this is your first time." And several people stopped me, and this is where I laughed. Several people stopped me and they said, "Are you a vet student?" I had two people stop me, and I was very honored to hear that. And I said, "No, I've actually been out over 11 years." But I did chuckle at that. And they're like, "Well, you look like you're a vet student." And I was like, "Is it because I look lost?" And they're like, "No, you just look younger." And I was like, "I will take it." But truly, everyone was so like-minded. The first session I went to was about herbals and detoxing the body. And then I found my way, I'm sure no surprise, to a lot of microbiome, gut, and nutrition lectures. I can't get enough of that stuff. And there were other lectures I wanted to go to. And of course, it always happens that there's time conflicts at the same time this other lecture is happening. But I also knew that since this is such a passion of mine, how can I get better at it? How can I learn even more to help pet parents? Has anything changed from what I was taught about nutrition in a non-traditional way, in an alternative way? Has anything changed since I started this journey 4 years ago of learning non-traditional alternative aspects of nutrition for my patients? And there was a keynote speaker on Sunday, and I was very impressed with her. In fact, I went to a lot of her lectures. Dr. PJ Broadfoot, intelligent, wise woman, so incredibly smart, so practical. Her lectures were so tangible. I was in the lectures literally, and they allowed us taking pictures of so many slides because there was so much valuable information. I made a note section on my phone, and I'm like, these lectures are so good that the slides themselves are so representative of what I would like to know and to continue to know and to learn. And she spoke on Sunday, and she was the keynote speaker again. Had no idea there was a keynote speaker on Sunday. I just looked at the lectures, was like, yes, there's stuff I want to learn. I'm going to go. And I was really inspired by her. She talked about the story. She's very well known in the community. And she talked about the story about how many times it took her to get into vet school. And if you're a vet student listening to this and it was hard to get in, or you're struggling, or you're pre-vet and you're listening to this, don't be discouraged if things don't work out the first time. She talked about it took her third try to get into vet school. And I'm like, man, if her pre-vet self could see her now, how cool would that be with how much she's done in advancements and studies and cases, and now she's teaching this younger generation. And so it was really a really cool experience and honor to be able to hear her speak and even hear about how the association, the American Holistic Veterinary Medical Association, started. This was their 40th anniversary. And it was really cool to see how it's come along the way and the evolutions and how big the association is. I think they said there's like 900 or 1,000 members right now. So it's really cool to see. We're still really tiny but mighty. And the full circle moments, I think, for me attending, I think all of it. It was just all of it just felt very cohesive to me. I think too, because it was a smaller conference. Now, I'll tell you, I've been to a smaller conference before. I've been to a Florida state level, like a state level association conference, in fact, locally to where I am. And it felt different than this. That even felt a little hustle bustle and in and out, and just the exhibit hall just felt different. And I went in with this a very open mind. I had no idea what to expect. Didn't know anyone who had ever been to this conference before. I literally went in blind yet open-minded. If you could even imagine those two. I was like, I don't know what to expect. I don't know what I would assume I know what to expect with like the lectures and seeing the conference schedule. That in that sense, it's a traditional setup, which is what I'm used to. But just the collaboration feel, like the energy in the room with people asking questions or making comments, or the clinicians giving the lectures, it just felt so collaborative, so that we were on mission together, that we were all in this together, rather than I'm the lecturer, I'm the clinician, and this is it. And it just felt like it was a very cohesive environment. And so it was really cool to hear about a lot of stuff that I had learned and been exposed to in nutrition, and to hear some other emerging aspects. And I'm trying to think, I literally have pages and pages and pages and pages and pages of notes, and herbals and detoxing and there was a lot of, it was very interesting to me is that there was a lot of overlap with human studies, which I thought was very interesting. And maybe that's from the holistic space. I feel like when I go to traditional conferences that there's maybe a little bit less of that assimilation or correlation. So it's really, it seems really interesting that sometimes some of these considerations are brought over from the human side and then applied in a clinical study environment and see how it works. Lots of talk on microbiome, lots and lots of talk of, I feel like the whole premise of this conference was like longevity. And then because of that, there was other topics that branch out from that, herbals, detoxing, cancer treatments, gut health, nutrition, tuning fork. I'm trying to think about cruciate injuries, management without surgery. And I felt like they were all focused on one thing, longevity and having your pet and our patients live their best life as long as possible. What are ways we can support it? One thing I noticed is that there was no bashing of traditional or conventional. There was facts stated that, hey, these are alternatives, and this is why, because when we use, these are the possible outcomes or side effects with using these traditional methods. There was no bashing at all. There was no shaming. There was, hey, if these medications have been shown to do XYZ to the gut, like this class of drugs has been shown to do XYZ to the gut. Here's an alternative to consider for that, that is safe, that is recognized. And if you're going to use these traditional meds, here's what to look out for. Here's to what prepare for. Here's to how correct it. And so I really enjoyed that there was no, it's our way or the highway. There was no bashing of, well, that's just wrong. There was facts. There was objective statements made. And it was really refreshing to see that. And it felt, I think that's what added to the environment is it felt even safer to be there. And there was a lot of different layers of people there. There were true holistic, there were integrative. I'm sure that there was some more conventional with that do some aspect of integrative or holistic. And so I think it was a really good mix of people there. It's surprisingly, I felt like it was a seasoned generation of veterinarians there, that there were less younger generation. Although, and I'll say, and it's also hard to judge by looks, right? Like that's not always fair and accurate. Hence, I had two people ask me if I was a vet student. But I did notice that, and that was interesting to me. There was more female veterinarians than male, but I feel like that's just the industry in general. There were some male veterinarians, though. I wouldn't say it was just female. It was definitely a seasoned veterinary community. And there was on Sunday, I felt like I counted a little bit more what looked to appear as younger generation. However, I did hear some people talking that they were practice management. I heard a few people talking that they were vet techs. There was a few vet students there, which I didn't know about until Sunday. There was a few that earned scholarships. So I don't know where those mix of those people were, but it was really encouraging to see that there was some younger generation and that there was a seasoned generation that was still so interested in learning and knowing. And I think that's important because they're influencing and they're teaching the younger generation because they're paving the way. And so it was really cohesive. I felt like on the topics, there were some I really wanted to go to, but I had to pick which one I wanted to go to at the same time. And so I flipped a coin and I told myself, especially when I go to lectures where it's the same clinician or lecturer giving several lectures in a row, I'm like, okay, just go to one, make sure that you like the way that they are communicating, that you can follow them, and it's not over your head or it's not too boring, and see how you go. And I enjoyed all the lectures that I went to. In fact, there was something I was like, man, I wish I could double dip and listen to both of you at the same time. And so what I'm really excited to bring back to my patients is, um, I guess, continuing what I'm already doing is more rooted in what I'm already doing, and lab tests that I have been leaning on recently after talking to those labs in person, those people. I feel even more confident in using their labs because of the level of support that they give their clients and their patients and their customers. I am even more excited to add in more alternative, non-traditional treatments to my patient care that are non-traditional but proven, safe, effective, like ozone therapy. I am getting more in learning and in depth with fecal transplants, non-sedation, learning more about additional supplements, herbal supplements, and just like doing a cohesive approach to my patients. That's what I'm really excited to bring back. There's other stuff out there that I think is so cool at the level of my practice, just not there needed yet to bring it in, but it's really cool knowing that it is there. The challenges and gaps that I noticed while there were, I think that collectively as an association and as a niche in the industry is letting the industry itself know that like what we have to offer is valid. That I kept hearing them say, hey, if you've got a study or a case study, please submit it to the journal. Please submit it. Please submit it. Please go talk to like the big governing body that helps organize the industry for us. And I think that was the biggest thing is like the more we can get out there, the more other veterinarians can really solidify what we have to offer as this part of veterinary medicine and that it is valid, it is effective, it is safe, it is proven, and it's not just woo-woo. And I think that that was like the biggest thing I saw is the conviction and the tone of like, hey, like the more we can talk about this to others, the more even pet parents are realizing it and they can come to us as veterinarians and they can feel safe and we can let our colleagues know who are very traditional or very conventional that take what you like and leave what you don't, but here are some things that you may want to take. And so it was really cool. I met some incredible clinicians and people. I saw Dr. Judy Morgan there. I didn't talk to her. Dr. Margot Roman, I talked to briefly. She's such a pioneer with gut health and microbiome. I talked to Dr. Jill, who is such a pioneer and so incredibly intelligent when it comes to ozone therapy, and talked to her. Um, Dr. Claudia, who's really into mistletoe therapy for cancer treatment. Talked to many different vendors, stopped by VDI Labs, Standard Process, RX Vitamins, Annicell, Wolf Creek Wellness, Chi Dog Food, Winwood Dog Food, stopped by Real Mushrooms. I mean, there's so many that I can't even, I'm sure there's some that I'm forgetting and I'm not trying to forget. Talked to Beamer. And so it was really cool. I kind of liked that the exhibit hall was a digestible size. I was able to tackle it over the 2 days and felt like I had just enough time to talk to. I went to every booth, whether it was something that I was interested in or was like, this is not going to fit in my practice right now, but I still want to hear what people have to say. And so it was really nice. Everyone was so welcoming and so kind. And it was really funny when I met Wolf Creek Wellness when we were when I stopped by the booth, I was just making my way and we ended up realizing that we are local to each other. And so really excited to see if there's a collaboration or see how we can help each other. Definitely check them out. They offer really great products if you're into alternative products for wellness for your pet or preventions. And my highlight, I think, from it was all of it. It was all of it. I had a great experience. I felt like everyone was really positive. Everyone was really into wanting to be there and to learn. And it was honestly really cool to see the seasoned veterinarians there with their pens out and their computers and their papers. And I didn't get that feeling, well, I'm just here to, get my CE and keep my license active. It was like that they were really interested and really wanted to know. They were really engaged. They were having conversations. They were making comments with the clinicians giving the lectures. They were making suggestions. It was real. It felt like really one big collaborative session. It truly did, rather than I'm up here lecturing to you and you're down there and you're here to learn. I didn't get that vibe. I got that vibe of, hey, if you've got a question, raise your hand and like, let's have a conversation about it. It felt, again, collaborative in the best way. And so this relates to you as a pet parent, if you're listening to this, that there may be other options, that a prescription life for your dog may not be what it has to be, depending on what your pet is dealing with. They may not have to live on prescriptions, and they may need to, but what are ways that we can support them, their immune system, their gut while they're on these meds? It just gave me a lot of hope that like we have tools in our toolbox. We're not just left with a wrench, a hammer, and a screwdriver. That we can have a leveling kit, that we can have multiple screwdrivers, we can have multiple drill bits, we can have multiple wrenches, we can have sockets. I mean, Saws. I mean, I'm now going off a tangent because I can't think of every tool in a toolbox now. But it really affirms that there are more tools in our toolbox and we don't just have to work with like two or three, that there are more and we use what we need when we need to. And so that's why I'm even more rooted that the gut is the center of so much of our pet's health. It's not the only part. There's also nervous system, there's mental health, there's physical health. There's so much that goes into it, but how much is rooted in the gut and what we do for them every single day, which is feeding them, regardless of the weather, regardless of their age, has such an influence over their life. And there's other modalities we can do in addition to that. And that is absolutely always something I talk about in my nutrition consults is when people come to me, they're like, I don't feel comfortable changing the food. Every time I try and change my dog's food, they have an upset stomach or whatever their hesitation is. And I try and walk through with them and sit there and listen and be a safe place. But here are other ways we can really either get to like the nitty gritty here, what's going on with your dog, or here's other ways you can support them. And I've had pet owners be, nope, I don't want to switch the food. I just want to do toppers. Come to me later, a month and a half, 2 months later, and be like, okay, I'm ready to talk more about nutrition. I'm ready. I want to do another consult. And I'm like, great. Okay, let's just see where you're at now. Let's see where your pet's at. Let's see where you're at. And how can we bridge the gap so that they can live even a healthier life and you can feel comfortable with that. And I want to invite you in this moment, if this is what you're looking for, I want to invite you to schedule a one-on-one nutrition consultation. That's exactly what we cover. We cover where's your pet's health at? Where do you want them to be? And how can you get there? Is it changing what's in their bowl? Is it elevating what's in their bowl? Is it looking at their gut health? Is it supplements? Is it lifestyle habits? Is it all of it? And so I will leave the link in that below. And wrapping up, were there any funny moments? I think other than somebody thinking I was a vet student twice, I think that was the funniest. I was honestly honored and humbled. And I look forward to attending this conference again. Next year it's in California. I don't know, that's a year from now. I don't know. I want to attend. I don't know if I'll attend all of it or what that will look like, but it's definitely something on my radar. It's definitely priority to me. And so that's definitely something I look forward to. And I'm sure as it continues to grow and evolve and get more members, it's just going to get better and better. And so if you are someone who is interested in an integrative approach, a functional approach, more holistic, check out the AHVMA. Check it out. I don't know much about them as far as teachings other than the big conference. I think it's really valuable and I think it's good. I think it's good to know both aspects. If you are going to be ultra conventional and traditional, I think it's good to know a little bit of holistic because when your clients come to you, then you can feel grounded in and rooted in saying yes or no and guiding them rather than just saying no because you don't know about it. That's why even though I really value integrative and holistic aspects, I still like to learn about conventional, traditional things so that when clients come to me, I can fact check in a good way, in an unbiased way, that it's not just me immersing myself in one avenue of veterinary medicine. Is that and it's hard sometimes because there's so much holistic integrative that I want to learn that it does take away from me learning conventional and traditional. But how can I still expose myself to that so that way I'm able to talk to both sets of pet parents and find how we can bridge the gap so that they can help their pet in a way that they feel comfortable with, but it's also in the best interest of their pet. So that was my recap of attending that conference. It was really interesting. I came back, as I do most conferences, excited, but this was a different type of excitement. It feels like it's like for the long haul excitement of like, these are skills and tools and avenues I get to carry with me rather than, okay, this is like this recent update. This is really exciting. I'm gonna put this into practice, but I know in 6, 8, 12, 18 months, this is going to change. And I'm not saying that about what I learned, that it's not rooted, it's not cement, that there is no change. It's just, it was different in the best way. It was really empowering. It was really exciting to be around like-minded people and to talk about these topics and the conviction in everyone's eyes. And so I'm definitely looking forward to how I can continue to evolve as a well-rounded practitioner to best serve my patients and their pet parents.